Maya, would you like to introduce yourself and your topic? Thanks.
Hi, thanks. I'm Maya Unnithan and I'm an anthropologist. I'm a medical anthropologist based at the University of Sussex. And I'm going to talk about my sort of work around sexual and reproductive health, and particularly in thinking about human rights models. I've got 5 minutes and I'm just going to hopefully I'll be articulate. Okay, my work is really focused on sort of 3 issues. One is I look particularly at reproductive agency, that is, what the capacity of people to help themselves, if you like, to do things themselves, of poor and marginalized women and families in resource poor, high mortality settings, and I'm particularly interested in what happens to agency in times of crisis. The second issue that I've looked at is how reproductive claims, that is how people make claims to do with reproduction and sexuality and health at the local level, both within their households, their families and communities, but how this is disjunct or different or similar to more universal framings of rights. And then in the third sort of context, I am particularly interested to look at how state and non-state institutions who work to address the health vulnerabilities of excluded and marginal groups, how do these institutions understand rights? How do they operationalize them in programs to do with maternal, sexual, and reproductive health? So this is kind of my research focus. I've worked in, particularly in Western India, in places like Rajasthan, where the climate is extremely harsh. There's drought and famine. Where there are extreme sort of social kind of pressures on women to bear children and to carry themselves in particular kinds of ways. So you see the woman who's coming to take water from the well has got her face covered because of the shame of not meeting people of particular kind of social kind of context, especially men. In terms of thinking about disaster and conflict, what I want to say is think about sort of the everyday context of disaster, which leads to further context of disaster. So I'm really thinking about small scale but routinized disasters, things like poverty, community violence, land loss, monsoon failure, which actually trigger a kind of forced migration. People may not want to migrate, but they're forced to migrate to particularly the rural poor towards cities. They come to the cities, live in temporary shelters in what are known as kachi basti. The whole name is itself, kachi means raw, uncooked, not pakka bastis, that are slums, which they have extremely poor sanitation or health facilities, and here you find women particularly suffer from reproductive tract infections. They have an inability, either an inability to wash or even the shame to visit toilets. Are they public toilets? They have to go to sort of drains and go very early in the morning. May have to hold on and not visit at all the toilets. There's a lot of sexual vulnerability in these contexts. This increases. And there's also a lot of gender and sexual kind of violence. Now these spaces are important to understand because these are spaces which become very quickly mobilized in terms of, for instance, religious violence or communal violence, where there is already this kind of context where then women become subject to, on top of everything, as well as sort of physical abuse. And here I'm thinking about particularly the violence that happened in Gujarat in 2002. And this has been sort of very well documented by feminist groups, where there's particular kinds of violence that is linked to gender. That is, if you're a woman, you will be subject to a whole set of bodily kind of interventions. And not only is it sort of violence at that moment of time, but also it leads to further unwanted pregnancies, unsafe abortion, as well as mental trauma. So these temporary shelters are spaces really where there are no rights, or there is in a sense a suspension of the right to have rights. And here we think about human rights as actually perhaps being quite impotent in cases where they really are necessary and are needed. and whatever help is given in these contexts is only providing sort of for women's and men's basic needs. So camps and detention centers, people are either dependent on agencies who provide for their basic needs or on states whose agents may be responsible for their persecution. So, right, I'm running out of time. Standard human rights mechanisms in this context are, they are formalistic, legalistic, requiring particular procedures. They're not useful. However, we actually need rights in this context. We need rights more than ever before because we need to address senses of victimhood, betrayal, and loss of dignity. We need to reclaim the agency that people have lost. We need to fight against the agents of the state, the discrimination of health professionals, and those in the community themselves who perpetuate this gender and caste violation, which also leads to violations against health. And what I argue is that civil society, particularly India, is really important here because it steps into a space where neither the people have the means or the capacity, nor does the state have the will. So civil society actors, human rights activists, lawyers, are important because they draw attention to state failures, they document atrocities, invoke and often translate and vernacularize international treaties, and they are actually, to finish, I would say that it's not all civil society organizations, but those civil society organizations are most effective, who recognize and work with the poor and marginalized women as agents of change in their own context. Thank you very much.